Hello guys, welcome to Mr. Coco's Nurses class. Today would like to look at birth injuries. So birth injuries, some people might think maybe this is not important or it doesn't come in an exam, but then this comes in your exam. So you should check your papers for birth injuries. The questions come in MCQ, cross match, and completion. So before we go in details, kindly, if you're not a subscriber, do please subscribe. And if you're a subscriber already, like the video, or you can even share it to your friends so that at least they'll have an opportunity to watch. So birth injuries, when we go into details now, we'll look at what kind of injuries do newly born babies have as a result of delivery. So this happens maybe during delivery or just being forced to the baby is being forced to come out, or during a cesarean section. So they might have all these injuries. So now let's look at what it is in the introduction. So when we look at birth injuries, we are looking at this process here. So it's the, we'll say, giving birth, it's a process. Okay, so if it's a process, and then this process will involve a lot of things, that's why I was saying it's a blend. So because it's involves a lot of things, so just giving birth to have things like compression, meaning that as the baby is going through the birth canal to undergo compression, contraction, tuck, and traction. So all this is more like the baby is being squeezed as it is moving along the birth canal. It's being squeezed, it's trying to move, and it's being compressed. So it moves just like that with a lot of these forces around it. Okay, so that's what it means. So when the fetal size, here we're saying when the fetal size or the presentation or just the neurological immaturity, complicates what we call this event, meaning that giving birth, there will be issues that will occur. The issues that will occur will be tissue damage, meaning that as the baby is being delivered, it can have maybe say tissue damage or just edema, or it can bleed, which we call hemorrhage, or a fracture. So all these processes which we've talked about, like compression, traction, tuck, and contractions, or even traction, all these will cause damage to the tissue of the baby. It may cause edema, it may cause hemorrhage or a fracture to the neonate or newly born. So many birth injuries, we can have maybe say bruising. The baby can be bruised, or it can have a swelling as well. Okay, sometimes it can have forceps scars, because you might use forceps while delivering, so the baby can have these forceps scars. These can be regarded as birth injuries. Even rare, maybe you can have fractures, so fractures can also occur. Okay, so that's what we have. So let's look at the definition of birth injuries. So when we look at birth injuries, we are looking at trauma. Okay, so birth injuries, when we look at it, it's trauma to the baby during the birth process. So it's just trauma to the baby during birth, the birth process. So it's just around here. That's how we have the definition. Okay, so birth injuries, so it's trauma or just injuries which occur to the baby, okay, or trauma to the baby during the birth process or delivery. So that's what happens there. Okay, then let's look at now what we call the causes. So what can cause birth injury? Okay, mostly you can have prolonged labor, meaning that labor has taken more time than it should. Say for example, labor that can go maybe 24 hours, a woman is just in labor, or even say maybe 30 hours, this woman is in labor. So this can be prolonged labor. So when this labor is more than the stipulated time, which I've learned maybe 16 to 18 hours, this becomes a problem, so it can cause injuries while trying to force the baby out. Breech presentation, maybe say legs first here. So this, when the legs are coming out first instead of the head, and then you're trying to pull out the legs, this can be a problem, because all we know is that we should have head first, not legs first. So this can cause injuries. Then premature birth. So those premature babies are also prone to injuries because their skin is fragile, their bones are very fragile. So that's what happens. Maybe say if the other one is a doctor's procedures. Under doctor's procedures, we can use forceps, okay, to pull out the baby. So these forceps, sometimes you can injure the lips, you can injure the face, you can find that there are scars on the baby. Okay, that's what happens. Other causes can be maybe small pelvis or irregular pelvis of the mother. So this can be a problem. If the pelvis is small, then the baby is being pushed. It can be CPD, that's what we call cephalopelvic disproportion. So this can be a challenge. Let's look at maybe say the predisposing factors. What could be the predisposing factors in this case? Okay, what could predispose a baby to having an injury? So most of these, they are more like interlinked with the causes. So if you look at the prime gravidas, those who are having babies for the first time, they're also prone to, to these injuries. Their babies are prone to the injuries. You might discover that maybe the birth canal is small, and then trying to push the baby out. You can use forceps, or you can try to maybe perform an episiotomy. Then you injure the baby. Okay, so you can have a lot of such injuries. Then another one is cephalopelvic disproportion. You're looking at the pelvis, which is small, and then maybe the head of the baby, which is the cephalo, is bigger. So there can be disproportion. So meaning that the passage is small, the passenger is big. This is what happens. Or maybe another one is a small maternal stature. You discover that maybe the mother is very small. Then it's been believed that if the mother is very small and short, this can lead to maybe say the passage being small, and the passenger can be big, injuring the passage, as well as the passenger who's the baby getting injured. That's what happens here. Excuse me. Another one which we talked about earlier is rapid labor or prolonged labor. Prolonged labor meaning that labor takes more than the stipulated time. Maybe it can even be 24 hours, like I said earlier. Other causes, other predisposing factors could be maybe deep transverse arrest, meaning that the presenting part of the fetus is arrested somehow. It's just caught up maybe on the ischiospines. So that can be a problem as well. It can cause a lot of problems or injuries. Then oligohydramnios. Oligo means low, or little, or nothing at all, or reduced. So oligohydramnios meaning that little amount of amniotic fluid can also predispose to a baby having injuries. Okay. Other predisposing factors as well can be abnormal presentation. We talked about a breech or legs first. Okay, this can be a bad one, or even buttocks first. It can be a bad one here. It can predispose to injuries. Then vacuum extraction, meaning that using a vacuum, or that thing people use, maybe say in the to unblock the toilet or to unblock the sink. Now imagine that is being used to pull out the baby from the vagina, okay, or just the birth canal, trying to pull out the baby. So that can be another problem. Then versions and extractions, same. You're using instruments to remove the baby. Instruments can injure the baby. Then babies of with low birth weight or premature infants, like I said earlier, they're fragile, so they are easily injured. Okay. Then fetal macrosomia. Macro is big, meaning that the fetus is very big. For example, those who are born from diabetic mothers, they can be macrosomic, meaning that they're big babies, so they can be injured as they're being delivered in their passage. Okay. Then large fetal head, if the fetus has got a big head, meaning that this can lead to an injury as well. Okay. Then fetal anomalies, the fetus can have abnormalities. So those abnormalities, they're prone to being injured while being delivered. Okay, so these are the predisposing factors that I have. You can add some more. I know knowledge is so vast with people. Nowadays, people read a lot. Then what about the types of birth injuries? So birth injuries can be categorized. So if you check out your past papers, you discover that they are categorized. They will even ask you questions to say which ones fall under, which ones of the birth injuries fall under soft tissue injuries, or which ones fall under the peripheral nerve injuries, or which ones may fall under hemorrhage. So if you look at the types or the categories, these we have, like, say for example, soft tissue injuries. We may have some from soft tissue here. We may have some which we'll list below. Or under peripheral nerve injuries, we may have. Then cranial nerve or spinal cord injuries, we may have some. Bone injuries, you see, we have a list as well. Intra-abdominal injuries, or even hemorrhage. So these are groups. So past papers will guide you to say, okay, what can we have, say for example, under soft tissue? So let's look at soft tissue as number one. So under soft tissue injuries, so if you look at soft tissue injuries, which is here, so they are associated with fetal monitoring, okay, particularly with the fetal scalp, meaning that they deal with the fetal scalp. The scalp mostly it's when you look at there's hair there, then there's a skin there. So that area particularly, that's what we're looking at. After your hair there, with the skin that you touch is the scalp. Okay, then there's a bone there after the scalp. So that's what we're looking at. So mostly soft tissue, they just look at the scalp. They don't go really to break the bone. Okay. Yeah, so let's look at the list that we have. We have the first one is cephalohematoma. Cephalohematoma, look at the head, and then there is hema here. Hematoma, we're looking at blood, which has more like grouped together or heaped together. Okay, so it has made more like a ball or something. So that's cephalohematoma. Then we've got Caput succedaneum. We're going to look at this. So under Caput succedaneum, we're looking at something which is there more like a fluid. Okay, it's a fluid which is there in the scalp, or just some edematous thing. So we'll discuss it in detail. So it's some fluid. Then subgaleal hematoma. So we're going to look at which part is the subgaleal, and then hematoma. So hematoma, we're looking at this blood, which is more like clotted or grouped together or heaped together, making a ball like, or a clot. Okay. Then look at also abrasions and lacerations. So if you look at these are soft tissue injuries. Okay, so that's what we're going to look at. Now let's try to see here. If you look at the diagram will show you here where there is a caput. We have just put a dot. That's a caput succedaneum. If you look at a caput succedaneum, as you can see, there is this midline here. This is the midline, and then this is a caput succedaneum just on top there. So it has gone crossing this midline. As you can see, it has crossed the midlines on both sides. So it's just an edematous swelling crossing both sides. We'll talk about it later as well. Then cephalohematoma. An hematoma is more like a clot, and as you can see, it's just one-sided here. This is where it is, just one-sided. So it's different from what you can see as caput succedaneum. Caput succedaneum is crossing this midline. Even this side, it's there. Okay, and this side, it's there. But if you look at cephalohematoma, it's just there. Okay, so meaning it's just one-sided. It's not crossing the midline. So this is the head. Okay, so we'll look at this is the head. So it's not crossing the middle part of the head. So more like cut a cross section on your nose there, up there. Now your nose should be the midline. So you just cross the nose, you go in your head. So one side of the head So that's where the cephalohematoma is. But Caput succedaneum will cross both sides, meaning that when you cut from your nose there up there, to be on the both sides. Okay. Then subgaleal hematoma, as you can see there, it's there is a skull there, which is the yellow thing there, which is the bone. Just above that bone, there is what we call subgaleal. Okay, that's that space. So now that's where somebody has bled. So it was also on one side there, so which is just forming blood there, this side. Okay, that's subgaleal. Then epidural, meaning that it's just below the skull bone there. So, but we're not really looking at the epidural hematoma for now. We're looking at cephalohematoma, caput succedaneum, and subgaleal hematoma. Okay, so these affect the head. So mostly it's a scalp. Okay, so scalp is just in your head there. So don't get confused with that. So let's look at now the cephalohematoma. Okay, so cephalohematoma, that's our first thing here. So as I was showing you in that image, the cephalohematoma, which is here, we're looking at where is the location now. The location is maybe say bleeding. Okay, because we talk about hematoma, hema here. We're looking at blood. So blood is so it has to, somebody has to bleed, meaning that the baby is bleeding. So this baby is bleeding from the periosteum. Okay, so some will say periosteal bleeding. Okay, periosteal bleeding is known as, so the questions will be coming like that. What do you call periosteal bleeding? So periosteal bleeding is cephalohematoma. Okay, so they'll say bleeding between or from the periosteum, and the blood collects between the membranes and the skull bone. So this is what they'll bring for you, and they'll say they'll use different ways to ask you to just for you to answer cephalohematoma. So periosteal bleeding or bleeding under the scalp, which does not cross the midline. Okay, so even this again, they'll say a swelling which is localized. It will come again a question like that. A swelling which is localized and does not cross the midline is known as cephalohematoma. So they will ask you in multiple choice or completion questions in section C. They will bring that. Okay, but then sometimes it may disappear and may it can cause a rise in bilirubin. That's another effect that it has. Okay, so this is what you know about it. Okay, it does not cross the midline. That's the most important, and it's bleeding. Okay, that's between the periosteum or from the periosteum. Okay, and the skull bone. That's what we have. Then other questions that you'll be asked again, just to find out if you know about cephalohematoma, they will ask another question to say, what do we call subperiosteal bleeding? So subperiosteal, meaning just the periosteum, like we discussed. It's from bleeding from the periosteum. So subperiosteal collection of blood, what do we call it? We call it cephalohematoma. That's another question that will be asked. Okay. So these are the questions that you expect from your exam. Okay, well, that's one way to answer. So let me say that this will resolve on its own, and it does not require maybe say the treatment that you might think it requires. So in terms of management, most of the times you say no laboratory studies are necessary, so we don't need to take anything to the lab. But maybe a CT scan or skull radiograph or CT scan may be performed just to make sure that there is no neurological damage, or if there is any neurological symptom which can be there. Okay, then transfusion for anemia, maybe you can do it. Okay, if necessary, if blood accumulation is significant, meaning if it's a lot, then you can perform a transfusion, but which is rare. Then aspiration of that hematoma, is it necessary? No, it is not required. You don't need to aspirate that blood. okay, meaning that it has to resolve on its own. Then hyperbilirubinemia, meaning that bilirubin will rise in this case, okay, that's what you're going to have. It will rise. So that's what's important about cephalohematoma. We've discussed it does not cross the midline. It's just bleeding from the periosteum or subperiosteal hemorrhage. That's what we have. And then let's go to another one, which is subgaleal hematoma. Subgaleal hematoma, this one also you may find it in your paper. So how do they ask it? Okay, so how they ask it, it's they ask it this way. When you talk about subgaleal hematoma, they'll ask you to say that bleeding between the scalp periosteum and the scalp galeal aponeurosis, meaning that that's the covering of the skull or the skull bone. The aponeurosis, it's a membrane. It's a membrane that covers the skull. So they'll ask you scalp galeal aponeurosis. Okay, so the bleeding between the scalp periosteum and scalp galeal aponeurosis is called subgaleal hematoma. That's what you find there. Then another question that is asked commonly here is that they'll ask, say, vacuum extraction or a forced caput. They'll ask you about that. Okay, they'll ask you a forced caput as a result of vacuum extraction because I've circled vacuum here. So a forced caput from vacuum extraction is called, some will say subgaleal hematoma, some will confuse it with caput succedaneum. So go for subgaleal hematoma because that's what you have, because it is mostly 90%. Okay, 90% of cases result from vacuum applied to the head during delivery. So meaning that the vacuum which is applied to the head during delivery will cause subgaleal hematoma. So mostly the hematoma that is caused during vacuum extraction is called subgaleal hematoma. That's what you expect in the exam, and that's what they bring. So let's go to another one, which is a caput succedaneum. So there is a caput succedaneum. So caput succedaneum, we can say it's the name given to the swelling. Okay, it's just a swelling that occurs on the presenting part of the head. Just the swelling that occurs on the presenting part of the head. So this, sometimes you may find that they ask you an edematous swelling that occurs. So I've circled edema there. They'll say an edematous swelling that occurs as a result of a baby being delivered after vacuum extraction. There's a difference with subgaleal. Subgaleal, you're using a vacuum extractor, or you're performing vacuum extraction, then blood accumulation or an hematoma forms, which is blood. You're going to say subgaleal hematoma. But here, you're performing vacuum extraction, then there's just edema or just a swelling that has occurred, meaning it's caput succedaneum. That's the difference. So caput succedaneum is just edema, okay, that has been formed. There is no blood involved here. So this swelling at some point will disappear on its own, okay? That's what happens. That's a swelling, and there is no blood involved in caput succedaneum, okay? So this problem can cause problems with feeding. So sometimes infants will have problems feeding with this problem, okay? So that's why sometimes we insert a nasogastric tube and feed with expressed breast milk. That's what we do here. Okay? Then sometimes in your past papers, when you check through one-word answer or multiple choice, there's a question which comes in to say a serosanguineous, which is here, a serosanguineous subcutaneous extra periosteal fluid collection with poorly defined margins is known as, that's caput succedaneum. So find out in your completion. That's section C. Sometimes you may find this question. They ask you a serosanguineous, subcutaneous, extraperiosteal fluid collection with poorly defined margins is known as. So you go for caput succedaneum. That's what you get there. Okay, and that's very important. At least you'll be able to know that section C you get a lot of questions correct. Okay, then what is it with caput succedaneum? Caput succedaneum extends across the midline. Okay, so when you check on the head, it will be on both sides of the head. When you cut in the middle, that's the midline we're talking about. So it will cross the suture line. Okay, that's what we have there. But with the cephalohematoma, it does not cross the midline. That's what we have there. Then management consists of observations only, so this is expected to resolve on its own. Okay, so it resolves on its own just within a few days. It does not require any treatment. So let's go to another one. So all these are under soft tissue. Okay, abrasions and lacerations. Abrasions and lacerations, these are just some maybe some more like a scratch on the baby. You may find that it causes a wound or just a scratch on the baby. So that's what we're looking at as abrasions and lacerations. Okay, so sometimes they might happen because of a scalpel cut. So it's more like you're cutting a baby, or maybe just some scratches on the baby's skin. Okay, so it may happen with a scalpel cut. Okay, so meaning that maybe you are using maybe a surgical blade and cut the baby's skin. Okay, or sometimes you can use maybe the instruments during instrumental delivery or vacuum forceps. So you can injure the baby's skin. So that's what we're going to have as abrasions and lacerations. Okay, so this in terms of management, we use antibiotics, okay, and just observation. That's what we have. Then let's move on to the other group or category, what we call peripheral nerve injury. Peripheral nerve injury, meaning that we are looking at these the peripheral nervous system, meaning that maybe some injuries of the legs or arms. So what injuries can a baby have, okay, with the arms or the legs? Okay, now this deals with the nerves. So meaning that we're looking at paralysis. There can be some weakness or paralysis to the baby. So this also you expected to find it in one-word answer, which is completion, or MCQ section A. So the first one is brachial plexus injury. So under this brachial plexus injury, also known as Ebb's palsy. So this is very common in your past papers. Check through Ebb's palsy. So this is just paralysis or weakness. Weakness where? On the arm. It's weakness on the arm caused by stretching of the nerves around the shoulder during delivery. And this is how exactly your question would come. They would ask you to say, what kind of injury is caused by overstretching of the shoulder during delivery to the baby? So they'll ask you such a question, and the answer is Ebb's palsy. Sometimes they'll use another word, excessive pulling, which is here, excessive pulling of the arm during delivery, or pressure, okay, on the raised shoulder is known as. So the answer again is Ebb's palsy or brachial plexus injury. Okay, so then the good part is that most infants will recover within 6 months. Okay, and does not require surgery unless otherwise, but most of them would recover. Okay, so this is the same part of paralysis to the arm. Okay, So damage, so sometimes you may discover a question to say damage to the brachial plexus leading to paralysis of the arm is known as Ebb's palsy. So there are a lot of questions just to find out if you understand about this from NMCZ. So damage to the brachial plexus leading to paralysis of the arm is called Ebb's palsy. Okay, that we've talked about, and we can go to another one. So if you notice, these are just short injuries which are mostly found in section A, B, and C. Okay. So another one is a facial palsy. Facial palsy, looking at the face of the baby. So there can be weakness or paralysis. Okay. So now, what causes this weakness or paralysis of the face? So mostly you find that damage to the nerve supplying the face can cause paralysis. Okay, it can cause paralysis of one side of the baby's face. So imagine the baby has got one side which is paralyzed, or it's weak, meaning that you know that the facial nerve was tampered with or was injured during delivery. Okay, so you may not what you find out will be they will not be able to close the eye on the affected side. Imagine the baby is unable to close the eye, so meaning that that is a problem. Or the mouth is droopy. It has a droopy mouth, or just one side is more like weak and it's sagging. One side of the face is sagging, meaning that that's droopy, and then it cannot even suck, or having problems sucking, meaning that's a problem. But then there is no permanent damage. That's the beauty about it. There is no permanent damage, so recovery will be complete. That's the beauty about this. But then these are injuries which we didn't take for granted. You know, it's not nice to have a baby born like that. So most of the times what we do is we feed via a nasogastric tube, because the face is droopy and it cannot suck. Okay, let's go now to another one, cerebral palsy. But then for cerebral palsy, we'll discuss this in details because it's a very big topic which we have also under NMCZ. So we'll discuss this further in details. So just an highlight, I guess, on this one, what really causes this problem here. So the belief is that there may be trauma to the brain. That's the belief. There may be trauma to the brain during the time of birth. That's what is believed to would have caused cerebral palsy. Some believe there may be trauma, some believe it's oxygen deficiency while being delivered. So that's how it is there. Okay, then the symptom is loss of movement, and the baby will not be able to move. Then the condition is not progressive, meaning that it does not improve or does not worsen. So that's why we say the condition is not progressive, meaning that it stays how it is. It does not go into severity. So that's why we're saying that each severity is determined by the type of damage which is done by the brain, but it does not improve. It does not go any further. It does not worsen. Okay. So a variety of medical mistakes, such as improper use of forceps to the baby, or maybe depriving the baby of oxygen. This is the belief that we have, to say that cerebral palsy will come as a result of maybe depriving the baby of oxygen. So this is the main belief that is there and causing cerebral palsy. Okay, so we'll discuss it further, and let's move on to the other one. So we've discussed the facial paralysis, which is facial palsy. Okay, now let's look at cranial, nerve, and spinal cord injuries. This is another category. Okay, so you may discover that babies might have these injuries. As they're being delivered, you may discover that you may damage the spinal cord of the baby. Okay, so the cranial nerve, we know about the 12 cranial nerves. These nerves are in the brain or in the head there. Okay, in the brain. That's where you may find. Then the spinal cord is, you know where it is, in the vertebral column. So this can be damaged through hyperextension of the head. You know what I mean. You may extend the head too much, or during traction and overstretching with simultaneous rotation, or just rotating the baby. They may range from localized neuropraxia to complete nerve or cord transection. This is very bad. Cord transection, meaning you cut the cord. So as you are delivering the baby, you may discover these are very fatal injuries. You can cut the spinal cord, or you can just injure it and cause paralysis. Okay, so let's be careful. Then when we look at cranial nerve injuries, sometimes you can say unilateral branches, okay, can occur, meaning that of the facial nerve, maybe the facial nerve can be damaged, or the vagus, or even just the recurrent laryngeal nerve can be damaged. Okay, and if you look at this, this can be temporal or can cause permanent paralysis. So that's why we cannot take it for granted, because these are very fatal sometimes and very dangerous. Let's just be careful as we deliver these babies. Then let's look at now what sometimes happens there. So compression by the, maybe say by the forceps or the forceps blade, has been implicated, meaning that mostly it can cause, it's the one that is really a culprit here to cause these injuries, maybe say to the face or the facial nerve injury. Okay, but most of the facial nerve are unrelated to trauma from obstetric instruments. So mostly we can say that compression is may be the one that is a culprit. So that's why I was saying compression appears to occur on the head as it passes the sacrum, meaning that as the baby is passing through the canal, the head can be compressed through the sacrum, okay, or even just the back is compressed. So that's why we can have these injuries. Okay, then physical findings of the central nervous system, okay, are asymmetrical with faces with crying. So mostly the babies will be crying and all that. That's what we may have here. Then the mouth is drawn towards the normal side, meaning that the face can be paralyzed. Okay, so that's what we have. Mostly more like a child is having a CVA. That's how the child will appear, because one side which is okay, will not droop, but the one which is not okay will be like drooping. The one which is paralyzed will droop, or it will fall, in short. Okay, then there will be wrinkles on the forehead, and eyelid is unaffected. So that's what to have. So mostly you may have all this stuff here. Okay, then what about then there is no evidence of trauma is present on the face. Mostly with the nerves, you may not find that trauma, maybe there's a cut, or there's something, meaning that the baby will have a clean face, but they have a problem with the nerves. That's what we have here. Okay, then we can have, let's go now to the other one here, where we're saying that management here. Okay, so what about the management? How do we do in this case? In this case, in terms of the eyes, we just put the patches, okay, and we put what we call synthetic tears. Sometimes they're called methylcellulose or natural tears. We just put there so that we protect the eyes. Okay, so then we can do a consultation with the neurologist so that they see the baby, and also the surgeon can be there, okay, so that they see the baby and the performance of the nerves. So these are very bad ones, and we have to be very careful, because some cannot recover, some can recover. What about the laryngeal nerve? We know the laryngeal nerve will supply mostly the larynx there, or the voice box, or even swallowing. Okay, so now laryngeal nerve, what disturbance can it cause? It can cause issues with the swallowing and breathing. because we know the larynx, the function is mostly breathing, which is there. Swallowing reflexes are controlled from there. Okay, so what can really be the cause here? Maybe the head was rotated or flexed literally. Okay, so meaning the head was rotated. That's why we're not supposed to really use force. We're supposed to be trained on how to deliver these babies, because we can cause these injuries. Okay, then what would be the infant's presentation? Okay, there will be a hoarse cry, meaning the voice will be hoarse as it cries. Then there will be a respiratory stridor. Okay, and most often there can be paralysis. Okay, laryngeal unilateral laryngeal paralysis. That's what you can find there. What about the swallowing? Would the baby swallow in terms of maybe you want to feed it? No, it won't swallow. So the swallowing will be affected. That's what we're going to have here. Okay, so now let's look at maybe say recovery. Do they recover? The issue is that treatment will now be asymptomatic, and we just treat according to the symptoms. Okay, then once the infant may be stable, we can just provide small frequent feeds and all that. Okay, but recovery is very difficult, because we need also to perform a tracheostomy on that infant. So this is very bad to the infant, so we need to be careful as we deliver. What about spinal cord injuries? Imagine the work of the spinal cord, meaning that it will control the limbs, the lower limbs, the upper limbs, chest movement, urination, and also opening of bowels. Okay, so that's what the spinal cord will have. Now let's imagine we've injured that. So the spinal cord injury, okay, can be incurred as a result of excessive traction and rotation. The one I've circled here, there can be rotation and excessive traction. That's what we can have there. So then why is it so that we can we can perform this excessive rotation or traction? It's because maybe the child was in a breech, or there was a breech delivery. That's why this can be there. Okay, so then the issue is that when there's a breech delivery, these injuries can occur, and that's what we can do. Then now we look at the major neuropathology changes consists of acute lesions, okay, which are hemorrhage. Sometimes it can bleed, or especially we can say epidural or intraspinal, okay, hemorrhages, or it can even edema. So this is what the baby might have. Okay, so now these hemorrhagic lesions that we may have, meaning the bleeding that we may have, can be associated with what? Degrees of stretching, laceration, disruption, or total transection. Now when it comes to total transection, meaning I've cut off the spine, meaning that this is now bad to the baby who's born like that. So the clinical presentation now in this case, do we have these babies alive? So sometimes we may have what we call stillbirth, meaning they can die just there, or some can they're being delivered, they just in the process they die, or just rapid neonatal death, mostly with the spinal cord injuries. So these can die, because we're looking at what the spinal cord does. The spinal cord supplies, like I said, the chest for breathing, the abdomen, the lower limbs, the upper limbs. So meaning that even respirations or respiratory function is damaged or impaired. So meaning that this baby cannot survive. So that's the problem about spinal cord injuries. So they can cause these issues. Say, for example, if you look at severe respiratory failure, so meaning they can fail to breathe. And then some can be put on mechanical ventilator just for support, but then you know that they cannot really survive, most of them. Okay, the infant may survive with weakness or hypotonia, meaning that the muscles are weak. So if they survive, that is okay. So that's the issue again. If they survive again, they may have a neurological disorder, okay, or hypoxic ischemic encephalopathy, meaning that this baby may also have what we were just talking about, cerebral palsy, because they are not receiving enough oxygen, okay, or they're just affected because they are not really breathing properly, so they might not have enough oxygen, so they may have a lot of issues here. Then sometimes when we go now to this diagnosis, we can perform MRI or CT scan there, so just to check the extent of the damage, okay. That's what we can do. Then sometimes you can give methylprednisolone. This is just to reduce maybe the swelling and all that. Then supportive treatment may be necessary. So, but it's very difficult to keep these babies. Then let's look at what we call now bone injuries. When you look at bone injuries, we're looking at fractures. Okay, so meaning that fractures can also be caused during delivery. So maybe say following a breech delivery or shoulder distortion, meaning that maybe the shoulder is arrested somewhere. So some people may try to use force, but then you damage the shoulder or you break the clavicle during delivery, okay. So that's what happens there. So that's why we're even talking about clavicular fracture. So meaning that the clavicle can be fractured, okay. So meaning that you can break the clavicle in this case. So that's why we are looking at maybe issues like shoulder distortion, okay. So meaning that you're going to damage the clavicle, you're going to break it, okay, and then it can cause pseudo paralysis, meaning that it's not really a true paralysis, but then there can be paralysis. Okay, so then what would be the issue here? During your examination, you may find that they are crepitus, meaning that there is noise, okay, and maybe even the bone is palpable or irregular. So you can say, okay, this is a problem here with the bone, meaning that you have broken a bone during delivery. Okay, then what about for you to know to say there is a fracture? So you just have to do radiological studies just to confirm a fracture, and then healing in these infants will take 7 to 10 days, which is very fast because they are infants and the bones are very soft, okay. That's what happens here. Then what about now the long bone fractures? The long bone fractures, we know this can also happen because as you are trying to pull and do all that, you can damage the femur and the humerus, so they can be broken as well. You can cause fractures to those. Then when do they heal? When do the callus form? They heal within 2 to 4 weeks, which is also very fast. So they really heal very fast, okay. And then let's proceed. We check out maybe intra-abdominal injuries. What about intra-abdominal injuries? So under intra-abdominal injuries, we're looking at these injuries in the abdomen. But we can say they are uncommon. They're not, you can't see them every day. They are not common, okay? But sometimes they are overlooked and can cause death. So this is where you find that a child or an infant is dead, but you don't know the cause of death. So intra-abdominal injuries, sometimes you can expect hemorrhage, okay, which is a most serious complication, okay, and the liver is mostly commonly damaged organ in the abdomen. So we may discover that maybe the liver was damaged and we do not know about it, and suddenly this infant dies. That's what we can have there. Then what are the signs and symptoms if we have maybe this problem here? So there can be bleeding, okay, this bleeding, but the problem is we cannot see it. So what we're going to have in the end is circulatory failure or collapse. You may discover that the vitals fall, they drop, because we are not able to see the bleeding. So that's why we have these problems of intra-abdominal injuries. So if there's intra-abdominal bleeding, you may discover that an infant may go in shock and may become pale because you are not able to see Then again, you can have this infant with unexplained anemia or abdominal distension because there is bleeding occurring there, so the abdomen is being filled up with blood. Then again, overlying abdomen on the skin, may become bluish, which we're calling cyanosis. So you can see cyanosis there. Then what can you do? You can do radiographic findings just to see if the problem is there, and you see which part is affected. Or you can do paracentesis, meaning you can extract the fluid to see if it's blood or what kind of fluid is accumulating there. Okay, then let's look at hepatic rupture. Hepatic rupture, meaning you're looking at the liver here. So this can occur as a result also as this what we've been talking about, these injuries, compression, rotations, and all that. So this can occur. So this, when we talk about hepatic rupture, we can also have the spleen rupturing. So the spleen can also rupture in the process of delivery. So let's try to be very careful with these problems here. So lastly, we're going to look at just hemorrhage. Okay, so this hemorrhage we try to see can occur anywhere. Now we're going to look at intracranial hemorrhage, of which we spoke about some things like cephalohematoma, subgaleal, but there's also what we call intracranial hemorrhage, meaning that it's occurring inside the brain, or just inside the brain there. So if bleeding is occurring inside the brain, what can really cause it? It may be caused by a skull bone, which is maybe deformed or broken. Okay, so this can be a very bad one here. So now what can happen if this infant is bleeding inside the brain? Okay, so meaning that it can cause damage to the brain. So, and it can cause what we call ischemia, and then hypoxia, so meaning that it can affect the brain. So for now, we're going to end here because some of the things are not really examinable, so they don't really bring most of the things here, but we're just going to end here. Okay, so as you have seen, you're going to be very careful with these birth injuries, and as you deliver, you should be able to observe, you should be able to examine these infants because they might have these injuries we've been talking about, and then study hard as well and try to really read as wide as you can because exams sometimes they may be very hard. So thank you very much for listening to Mr. Coco, and have a pleasant day.